Hello, my name is Paul Leong. I'm a facial plastic surgeon in Pittsburgh, Pennsylvania. I wanted to record this short video explaining the pros and cons of the various incisions that you can make for a facelift, and I'm focusing in this video on the portion of the incision that's directly in front of the ear, what we would call preauricular. And so fundamentally, there are two options. For many decades, for a long time, many facelift surgeons have opted for the first incision. That is, essentially, it's a pretty straight, pretty vertical line coming down here in front of the ear. And there are advantages and disadvantages to making the incision in this location. What are the advantages? The advantages are, well, for one thing, the straight truth is that it's simpler to make surgically. It's a relatively straight line. And if you compare it to this incision that we're going to talk about in a little bit, which is a bit more of a curved line that hugs the edge of the ear, it's easier to make surgically, and of course there's some advantages to that. The second advantage is that when you make the incision here, and you understand you're going to then lift the skin this way when you do the facelift, you don't have to dissect, you don't have to disturb the skin over this little part of the ear called the tragus. And therefore, when the facelift heals, you're not having to experience healing and any possible distortion or stretching of this area of the tragus. And so for these reasons, there are these advantages. Now, what are the disadvantages of this first option, the option with a straight line down in front of the ear? Well, they're sort of obvious if you think about it. The human eye is pretty good at picking up straight lines. And therefore, even if this heals fairly well, the downside is that the human eye can see it because it's a thin line. So what are the disadvantages of this first option, the straight line down in front of the ear? The disadvantages really are pretty commonsensical if you think about it. A straight line, a cut on the side of your face, is more conspicuous visually after the facelift procedure heals. The human eye is pretty good at picking up a straight line, and so to me this is a significant disadvantage. Another disadvantage is that when you move the skin back like this, you understand you're going to remove a certain amount of skin. That's part of a facelift procedure, and therefore you're going to bring skin from, say, here and bring it right next to the skin here on the tragus and sew that together. And so the challenge with that is that the tone or the color of the skin here can be a little different than it is over the tragus, and that then can make the incision, again, easier to see. So those are the advantages and disadvantages of making this first straight line incision. What's the second option? The second option you can see here, I've drawn it. If you look at this black line, it hugs sort of the cartilage of the ear far more closely. In this upper part of the ear, it's a curved line like this, and you make sure that it falls sort of where the shadow would catch the front of the ear, and so that hides quite well. And then most importantly, it comes here, you wouldn't say behind, but sort of on the back of this critical piece of the ear, the cartilage called the tragus. It sneaks in here behind this, and then comes out again here and comes around the corner like that. So this, I will tell you, is the incision that I very much prefer, and I think in recent years more and more surgeons are using. What are the advantages and disadvantages? The advantage is sort of, again, fairly obvious. An incision that hugs the side of the ear, and especially that hides behind this tragus aspect of the ear, is going to be harder to see. I find consistently, if you look at facelifts where the incision is straight down versus the incision that hugs the edge of the ear, the second one, the one that hugs the edge of the ear, is harder to see. That's the main advantage. The disadvantages, well, I mean, certainly it takes a little bit more time for the surgeon in the operating room to do this, so it's a little bit more surgically challenging to sculpt it to the edge of the ear like this. And then the other disadvantage that's discussed is that when you make the incision back here, of course you have to lift the skin off the tragus, and therefore when you pull the skin back and you, in the facelift procedure, and you reposition the skin over the tragus, you have to have healing over the tragus. And some people would argue that you can get a subtle distortion or a change in the shape of the tragus. I suppose my response to this is that, again, it depends if you do it carefully and technically correctly. If you do this carefully, and especially if you don't have any tension placed on the skin with the facelift procedure, it should not change or distort the position of the tragus. And so, my preference, I will tell you, is that in the great majority of cases, I prefer to make this second incision, the incision that is hugging the edge of the ear, as opposed to the straight line in front of the ear, and most fundamentally because it simply looks better in the great majority of cases after a facelift procedure. So those are the pros and cons of these two incisions. I certainly hope that's helpful to you as you consider your facelift procedure. Thank you very much.